Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
Hey everyone, welcome back to the Wild Health Podcast. We're a genetics-based precision medicine company that's exploring all the big questions around holistic health, wellness, and performance optimization. If you're tired of the traditional healthcare system and want to sign up as a member with us, head over to wildhealth.com. And if you're someone who's looking for a high-touch, all-inclusive concierge medical experience specifically designed for executives and high performers, check out our premium program at wildhealth.com/premium. Now let's get into it. What's up, Carl?
Not much, bro. How you doing?
I'm good. Hey, have you had any patients talk to you at all about this book that Dr. Peter Attia wrote called Outlive?
He wrote a book? No. I had my record right now is 3 in a row. But I haven't tied it yet. I've gotten 2 in a row since then, but never 3 in a row. So it's kind of like when I used to work in the event and I was younger. My record was 6 patients in a row telling me I was too young to be a doctor, and I tied it twice. It feels like that kind of thing where I'm just like, yeah, no, I know there's a book out there. Yeah, I'm aware.
Yeah. No, well, I mean, I have to say, it's about time that we did a little bit of a quick pod about Outlive.
Yeah.
I want to say, like, first and foremost, thanks, Peter, for writing this book, because I think it has collectively probably saved me 20 plus hours of explaining our approach to, treating patients and preventing disease as opposed to waiting for disease to develop, and just the idea of there being an optimal state of health as opposed to teetering on the border of a bunch of abnormal labs and having your traditional physician tell you that everything's fine.
Right.
So thanks, Peter, for writing this. You definitely shortened my conversations about stuff that we're all starting from a little bit more of the same playing field when I'm talking to patients who've read this book, and it lets us spend more time diving deep into what's going on with them. So I appreciate that.
Yeah, no, I'm like super grateful. Like it does make me want to do the like slow golf clap, like it's like the thanks, big guy. And the idea that it saved you 20 hours and it's only been out a couple months, it's like. Yeah, I mean, I have these conversations every day now, and I literally will have, call, and I've even, I'm referencing it to patients when they're just like, wanting more, and I'm like, hey, I have a lot of time for you. I don't have 20 hours. Let's go through this and let's talk about these different things. Let's set up an appointment again, but in the meantime, your homework is to go through this book, and also this book, like the end of Alzheimer's. I'll talk to that with people who are ApoE4/4s or have other health things I'll reference. So, or they're struggling with change, and like I'll send them to Atomic Habits or that stuff. But this has become one of the books I'll reference in my armamentarium of books to give to people. And so I appreciate that. And it is just a great summary of things that we've been doing over the last, 5 years.
Yeah. Totally agree. And it's funny, we did have sort of the all the books that we would typically recommend to folks were like chapters.
Yeah.
But we didn't have the table of contents.
Yeah.
And not to belittle the book, I mean, it delves pretty deep into some of these topics, but, looking at Why We Sleep by Matthew Walker, or looking at Atomic Habits or The End of Alzheimer's, those are all focusing on individual pillars of health, but like, why are they so important, and how do they fit into the larger picture? I think, Peter Attia did a wonderful job with setting that out. So, for those, first of all, highly recommend Outlive. I forget the tagline, but I'm sure I can look it up, or any of you can. But Peter Attia, Outlive. I don't have the book in front of me. It's actually in a very wild health move, sitting in my sauna. It's
Outlive: The Science and Art of Longevity.
There you go. So highly recommend. Go ahead, pick it up. It's on Amazon or wherever else you want to buy your books. If we're going to do a quick overview of it, I'll start us off. One of the things that I love that he outlines pretty early on is this concept of first of all, medicine 1.0, 2.0, 3.0. We've chatted about that in the podcast before, and I don't think we need to belabor it or go into a ton of detail. One of the other things I love that he outlines is sort of the four horsemen, trademarked, registered to Peter, I think now, of cancer, cardiovascular disease, insulin resistance, and what is the other one? Inflammation? Can't remember.
No, metabolic.
Metabolic. There you go. Inflammation is part of all of those. That's why. Wait, no, hold on. Let's get this right. Cancer, cardiovascular disease, insulin resistance, which is metabolic.
Dysfunction. Yeah.
And then
you said cancer, dementia. Heart disease, neurodegenerative disease, right?
Neurodegenerative. Yeah, that's dementia.
So this is actually one of my few problems with the book. Sorry, unless you're going off on a rant here,
No. I was trying to set up the T-ball for you so you can come in and take a swing.
No, well, yeah. I mean, I really I have eerily similar philosophies to him when I'm reading this, going when he's talking about his residency training and how he came to his thinking. The whole time I'm like, yeah, 100%, buddy. But one of the things he talks about with the Four Horsemen is there's other things that he talks about throughout the book that I feel like are just as impactful and should be kind of like, I have 7 things in my head of how I structurally think about it. So I think about cardiovascular disease. I think about metabolic dysfunction. I think about cancer. I think about neurodegenerative disease. And then I also think about, and he says this, but he doesn't include it in these 2 of these. He doesn't include that in his Four Horsemen for whatever reason. I think it's just catchy to say Four Horsemen, but mental health, which he is very explicit about, but it doesn't include that as this major thing that impedes people's health span. It lessens their longevity. So mental health, atrophy. So I kind of group that into, sarcopenia, loss of muscle, osteopenia, loss of bone density, and just loss of that kind of cardiovascular fitness that just leads to, I don't have a better term than just atrophy, and leads to decreased health span and decreased longevity. The third thing, which admittedly is involved with all the other aspects, is inflammation. So inflammatory processes that can be from all sorts of different areas that contribute to all these disease processes in such a way. And so I kind of think of it as 7 things, and maybe I'm making it not as simple as he is, but when you look through the book, it's very clear he spends a large amount of time addressing atrophy. He just spends a large amount of time talking about mental health. And he is implicit in a lot of the things he's saying is inflammation. So that is maybe I'm being nitpicky, but that is one of my, I have kind of 4 issues with the book. But
let's keep going. All right. So you've got the 7 seagulls, or
7
whatever
seagulls.
They're called. Seger.
Yes,
metaphor.
Seger's 7. Seger's 7 death. I don't know. I feel like it should be more dramatic, but. Again, I feel like I need a marketing agent.
Yeah, you do.
Yeah, you do. The other thing is there are times that he is overly dogmatic about certain things. That I think the greatest example of this is his discussions around ApoB, not just in his book but in his podcast as well. That. So here's the deal: is the way I think about it is it's not ApoB. Excuse me. Lowering ApoB is I want to be very aggressive about that. However, if you have no family history, you don't have significant genetics around cardiovascular disease. You don't have insulin resistance. You don't have high blood pressure or inflammatory markers. I'm not gonna get your ApoB to 40 if your ApoB is, say, 60 or even low 70s. Am I gonna do that? Probably not. It doesn't make that much sense to me. It just becomes, it's just the risk of medications versus like the whole thing makes less sense. In addition, if we do a coronary artery CT scan on you and you don't have plaque burden, and your ApoB is 60, 70, I don't know if that makes sense to me. So I think there's some overly dogmatic statements, and there's other ones scattered throughout the books that I'm like, hey man, I don't think we need to be that extreme with everybody. And at the same time, he does say, we're trying to be individualistic, but then there'll be these sometimes overarching statements that are very, dogmatic at the same time, which I feel like that hypocrisy kind of I get a little as he says, wrapped around the axle. I guess I could put a fifth one in there, but it's kind of a funny one. But things that are so number 3, I would say, is sometimes the book talks about associative data, so we make associations of, you have this risk factor and that is associated with this. Sometimes it's a bridge too far, where we're speaking out of both sides of our mouth. We're like, well, this is just associative data. That doesn't mean it's true. And then at the same time, we're like, well, this is an association. We should really act on that. And I don't necessarily always disagree with them, but if I was from an outside perspective and not involved with this, I would be like, well, wait, you can't have it both ways, man. You can't have this clear association, or grip strength. Grip strength is associated with longevity. Okay, we're making these associations that I think are probably true. I mean, because it's just a surrogate for these other markers. But I think there's sometimes I don't necessarily disagree with him, but there's sometimes I think it is very hard, and intellectually, I think we have to step back and be really honest with ourselves about what we do know and what we don't know.
Yeah.
Number 4 would be the one I've spoke about before, and this is I think he mentions this offhand once, is that in order to do medicine 3.0, there's going to have to be these systemic medical changes, and there's just, there is implicit in just that everybody can do what he's suggesting. And the reality, the financial feasibility, and just the time suck for some of the things that he is recommending or that he has done for himself, hell, things that I've done for myself, is a level of privilege that not everybody is able to achieve. In fact, most people.
Is actually available to a small subset of people.
And that, I think he mentions it at the very beginning, to do this, medicine 3.0 has this systemic, will require changes in billing and stuff like that. But I mean, so DNS, so dynamic neuromuscular stabilization training, that is one, hard to access. Most people don't have a DNS trained therapist in their area. 2, is expensive, and probably isn't covered by insurance, or so there's that aspect of it that kind of gets me. That being said, all the things, most of the science around what he's saying, this is how I practice mostly, his opinion about nutrition, that it is the religion / politics of longevity medicine. Couldn't agree more. Exercise is king, meaning of all these things, the 7 things I listed, exercise is an important role in all of them, and he's very explicit about that repetitively. Yeah, I mean, it is overall like an amazing book. I have some small things that I wish were different, and some of them are out of his control, frankly. So,
yeah, and I mean, I think I would, just to backpedal to either number one or two. I think the message that as a whole, population wide, we should be more aggressive about lowering ApoB, I think, than we traditionally are. I mean, ApoB is not typically even covered by insurance, so definitely we're not being as aggressive as we should about it. That said, I think you make not explicitly, but in terms of, you didn't explicitly say this, but in terms of the points that you're making, medicine 3.0 or 4.0 is highly personalized, and just because we want to be more aggressive about lowering ApoB population wide to reduce atherosclerotic cardiovascular disease risk doesn't mean that everybody needs to go on a statin, doesn't mean that everybody needs to lower their ApoB to 40 or 50. I think that there's definitely some nuance in there, but you're not going to write an individual book for every patient based on their genetics and their own particular health situation. So I give them a little bit of a pass on that one for sure. And some specific things that people have asked me about. I think leading off the list is this book is a wake up call about heart disease risk. Wait a minute, my primary care doctor is sending lipids that don't actually check for the lipids that are the highest concern, and I've never had a coronary artery CT scan, and I should start working on this in my 30s or 40s or earlier, as opposed to waiting until I'm 60 or 70. So, one of the questions I get is sort of what tests to take, and with that, kind of what does insurance cover, and how often should I do these tests, and as always, it depends, but I think, that's not using that as a cop-out. Most folks, I'm looking at an NMR lipid panel, and that's going to include ApoB along with Lp(a) and some of the other cardiovascular markers. And then, I don't believe that everybody needs a coronary artery CT scan, but when you're looking at somebody with one or more significant cardiovascular risks, whether that's family history of early disease or it's dyslipidemia or hypertension, et cetera, I do think that it adds significant value. Insurance doesn't tend to cover ApoB. Many insurance companies will cover coronary CT, but they tend to cover coronary CT in a very medicine 2.0 kind of fashion, which is if you have stable chest pain, which is already beyond the point where we want to detect your atherosclerotic heart disease, it'll be covered. So those do tend to be outside of the insurance space, or at least only partially covered. And that harkens back to one of your call outs, which is pretty expensive to be a patient in medicine 3.0 or 4.0 today in the United States. Get some questions around nutrition, getting enough protein, what diet works best for people. We are not going to dive into that. That is highly personalized. I do think that precision testing can help you get insights into, what are dangerous or more problematic, maybe macronutrients and what your particular needs are based on your goals. Questions about neurodegenerative diseases, so sort of what to test and how to prevent neurodegenerative diseases. And I think, if we were going to have a take-home message for patients, and this is what I tell people who ask me about this, is I do think it's important. Like if you were going to pick one genetic test to know the result of, I think you could make a really strong case that ApoE status should be that one test. I think there are other tests that are also really valuable, obviously. But I think in terms of knowing how to mitigate risk for cognitive degenerative diseases, I think knowing how to make choices around what activities you may do, with regards to head injury, how you might integrate ketones or not into your health strategy. I think there's a lot to be gained from knowing your ApoE status, and less so some of the other, what do you really, look for outside of ApoE for neurodegenerative disorders. I think, we're looking at all the things you can kind of optimize in the background, and whether that's hormonal health or it's inflammation.
I'm looking
or
at
some of
vitamin
the other
D,
root causes.
homocysteine, and CRPs on people, but really from a genetic standpoint, ApoE.
Yeah. Peter talks about his sort of 3 dimensions of fitness, and in terms of VO2 max training, which is high intensity training, zone 2 or metabolic training, just to improve mitochondrial density and glucose and insulin health, and then strength training to avoid the sarcopenia, atrophy, bone loss, etc., that you already chatted about. I think, he does talk about balance and core, and I know that that's basically how you talk about it with your patients, because you're my doctor. But it's, I do think that this is something that I think for some reason, getting it in the book, I think I've had a lot more patients open to this.
Yeah.
And that's one of the things that I'm really grateful for him writing this book, is we've been talking to folks about balancing their exercise regimen with a mixture of high intensity, zone 2, strength training, balance. And depending on who that patient is, a lot of folks go, but I just don't really like X. Right. Like I want to do CrossFit 5 times a week. That's all I want to do.
Yeah.
And there's no zone 2 training. And then no surprise, we're seeing some of our more avid CrossFitters with insulin resistance. Yeah. And I do think it's opened up the door, and not to pick on my CrossFit friends. I love my CrossFit friends, but if you're an endurance runner, they're good people. But if you're an endurance runner, right, you're not necessarily doing strength. And I think this sort of middle road of a good mixture of something from each food group, exercise wise, has really, I think the book really helped open that up.
Yeah, and I think one of the things he talks about with that is with the stability work, which even for me, like I preach this to people when he's talking about DNS training and really looking at the function of your squat, like I think about that, and my squat's kind of a little ugly, I was like, I probably need to spend a little time on that, but I think bringing that, one of the things that people in medicine talk about all the time is that, you fall when you're 65 years old and you break your hip, your, 1 year mortality rate is around 30%. And, different studies you look at, that's different, has different results, but I bring that to my patients all the time. And so that helps me build this discussion around, like, that's part of the reason we're doing strength training, is so that when you do fall, you don't break your bone. 1. 2, we're doing core and balance work with that, so that when you do stand up, you don't fall. Or when you're hiking the Grand Canyon when you're 75 or 80, which is what I want you to be doing, or what you want to be doing, then you trip on a rock, you don't fall and break your hip, right? So that's why we're and that sort of thought process where he's thinking about where you want to go, but also where you're at right now, and are those things lining up? Like, that is a discussion I'm having with people, but he does it in such a structured way that it's like, okay, like it takes the effort out of me trying to explain that to people, which is nice.
And then I think the only other big topic that I've had people come and ask about is a topic that I think comes up all the time in the health-oriented, longevity-oriented community, which is I think Peter refers to this stuff as exogenous molecules, which I think is, all encompassing and is great. But like, is there a pill? Like, let's just keep it simple, right? Is there a pill, and that pill may be like an IV pill or whatever, an IV infusion instead of a pill. But is there like a hack / medication or supplement or something similar that can help me live longer? And, this discussion almost always pulls in, rapamycin, intravenous NAD plus or NAD precursors, metformin. Like there's a lot of usual suspects that kind of come up when you're in this space. And I kind of have two things that I fall back on when I'm having this conversation with patients. One, there is not a single medication, supplement, etc., that's going to replace everything that we've talked about for the last 4 years on this podcast.
100%.
Right? It's still going to be about exercise and proper nutrition and sleep and stress reduction and you know, community and mental health and all the things that we talk about. With that said, are you going to move the needle like that last 2% to 5% or something with supplementation? You know, I'm not convinced. I think that the NAD world, certainly, we don't even really know if NAD, like just recently there was a study that looked like NAD precursors, NMN in particular, did increase serum NAD concentrations, but we don't know if that increases intracellular NAD. Right. And we don't even really know if NAD supplementation necessarily confers longevity in humans. So a lot of unknowns. I think metformin, I'm not averse to using metformin in my patients with hyperinsulinemia or insulin resistance, but I don't tout it as a longevity drug. And I think, you know, maybe in the next 5-10 years when we see results from the TAME trial, we will have an answer on this. But until then, I'm sort of grain of salting it. And then rapamycin. And, you know, in animals, some really compelling data, both on health span and on lifespan. In humans, we just don't have trials to support rapamycin's use. It doesn't mean that we haven't dabbled with it in folks who are motivated. I think the risks are extremely low in the way that it's dosed for longevity. It does seem like pulsatile dosing and low dosing is, you know, just as likely to improve your immune function as opposed to suppress it, and, you know, not really serious long-term side effects that we're aware of, but also, you know, to be determined. And for anybody who's listened to us or listened to Peter or anybody else in this space, you'll see, you've come to learn that, you know, 6 to 9 months later, we're going to turn around and say, actually, what we thought about this is totally wrong. Right. And I just feel like rapamycin, NAD, and metformin for longevity are all sitting there waving that flag going, hey, remember when you talked about stuff and then it was totally wrong and then you changed your mind about it 6 months later? Like they're all the most likely. I don't think I'm going to turn around and say ApoE isn't worth knowing for neurodegenerative risk. I don't think I'm going to turn around and say, yes, a diet should be personalized for patients, or you should have a balance of different types of exercise. But I have a high index of suspicion that I'm going to turn around and say rapamycin, NAD, metformin, what the heck were we talking about? Right. Like even 6 months or a year from now. So, you know, interesting, but we all want a quick fix. It's human nature. I get it. But as of right now, I don't think the answer to a great health span and a great lifespan lies in a supplement or a medication. Yeah,
I think the discussions I end up having with a lot of my patients, especially those who are really like in the space and committed, most of them end up in the end not even really wanting to do those things, even if they originally come to me, because they realize that if they focus on those, you know, especially around exercise, you know, nutrition, and just like the basics, that is a lot of work, and that's where most of the gain is. So like getting, you know, doing things outside of that, like becomes like almost like kind of confusing to people. They're like, yeah, why would I do that? I need to just focus on these things that actually make the huge gains that I can see and feel and we can measure, you know?
Yeah. Please get get as much help as you need and focus as much as you want to on your mental and emotional health before you focus on your rapamycin or NAD use, right? I mean, talk about something that's going to translate into true health span and true health. I think there's other places to focus first.
I think the one last thing I'd like to say is that, you know, I'm a pretty vulnerable dude. I think I try to be pretty honest and open, especially with my friends. I think, you know, Attia's discussion at the end around his own struggles, around his own anger and his own childhood and trauma, you know, that's the biggest area I'm like most impressed with. You know, I know a lot of surgeons. Not a lot of them are super vulnerable and open. No offense, surgeons, good people. But
some of my best friends are surgeons.
Some of my best friends are surgeons. Yeah, no, that's actually true. But how he handled that, and how it was written in the book and how it came across, I don't think it could have been done a better way. I mean, it was just, matter of fact, but also powerful. And so that was probably the most impressive part of the book to me.
Yeah, have to plus one that I think the stigma around mental health in medicine is such that people just don't talk about it more often than they should, as often as they should. And I really appreciated him doing that. I think that, open dialogue is going to be the first step towards improving some of that. And, I don't know how much mental health disease we see in the healthcare population, but it's staggering. I mean, I know you and I are both deep into this work, so it's I appreciated that from him too. So I'd say this is really like sort of our first book review on the Wild Health podcast, but we got so many dang questions about Outlive that it just seemed like it was worth doing. So I'm gonna give it I don't know, 5 out of 5 mackerel. What's our grading scale?
I think we should do mackerels. How many mackerels? 5 out of 5
Probably
mackerels.
mackerel.
That's pretty great.
Yeah, I'd give it 5 out of 5 mackerels. I'd say there's a couple of things. No book is perfect. No podcast is perfect. Nothing's perfect. But I really overall highly recommend. And I'm not sure if it's even possible to have a sequel, but would read it if there was one. And definitely enjoyed making my way through that book. So thanks for talking about it with me, Carl.
Man.
Love your points in perspective as always, and we'll see you soon.
All right, man.
Thanks so much for listening to the Wild Health Podcast. If you're a Wild Health patient, you might not know, but you have access to our referral program. This gets your friends and family 25% off Wild Health services. Just head to Clarity, and in the top right corner, you'll see Refer a Friend. Click there, and you'll be brought to a page with your referral code. Happy sharing.